Senate Bill 245 left before us. Welcome, sir.
Thank you, Mr. Chairman, members of the committee. I'm not sure that the full committee has actually heard this bill before. I know it was heard in subcommittee about 2 years ago. This legislation has to do with conversion therapy, what's called the conversion therapy. And just, Mr. Chairman, first of all, as an administrative matter, to conform my bill with Delegate Hope's bill in the House, I was hoping to make one quick change, which is to change the title and the definition of conversion therapy to sexual orientation change efforts.
All right. Well, the clerk, does the clerk understand the amendment? If so, you can report the amendment.
Mr. Chairman, can Senator Shervill repeat that?
Sure. If you just look on the title on line 13 and on line 14, replacing the words conversion therapy with sexual orientation change efforts. That would conform my bill to the bill that's on the other side.
Okay. Well, I think we've heard it, and I think we've got it. Thank you. All those in favor of the motion for the amendment will say aye. Aye. Opposed, no. And the amendment's agreed to. Senator, thank you for coming in. With your consent and the consent of the committee, we'll put a 5-minute clock on this one as well. Go.
Got it. Thank you, Mr. Chairman. Conversion therapy basically is the practice of trying to give a child therapy to convince them that they are not gay. The legislation is drafted prohibits a licensed Virginia psychotherapist from engaging in this kind of practice, but only as to children. Does not have anything to do with an adult wants to make that choice, only if this is being done to a child. Really quick, I'm going to talk about the lack of medical support, the evidence that this kind of practice is harmful, which has been validated, and lastly, I'm going to talk about what this bill does not do. First of all, in 1973, the American Psychiatric Association declassified homosexuality as a mental illness. Before then, it was classified that way, and since 1973, it is not. They also, just so we're clear where this practice came from, before 1981, techniques that were used to convert people from not being from homosexuality included things like ice pick lobotomies, chemical castration, hormonal treatments, electric shock, nausea-inducing drugs, and things like that. I'm not going to get into the specific details in light of the children present, but there were a lot of things that used to happen that now are no longer done. Instead, what's done are these type of so-called counseling involving counseling and videos and other things, which are very harmful. Existing research has shown that when a family tries to engage in this behavior to convince a child that they are not homosexual, the children are 8 more times likely to commit suicide, 6 times more likely to report depression, 3 times more likely to use illegal drugs, and 3 times more likely to be at high risk for HIV contraction. This type of legislation prohibiting this has been passed in almost 10 other states, 9 other states so far. It's been upheld by the courts. There's been juries which have found licensed professionals guilty of malpractice for engaging in this for children. So the world out there has been condemning this across the country. The American Psychiatric Association has labeled it unethical since 1998. In 2001, President Bush, as the Surgeon General, said that there was absolutely no scientific support to support the idea that sexual orientation can be changed. The practice has been condemned by the American Counseling Association, the National Association of Social Workers, the American Academy of Pediatrics, the American Association for Marriage and Family Therapy. It's just not supported by any professional organization whatsoever. The last thing I just want to make clear is what the bill does not do. The bill does not prohibit, again, anything involving an adult. If an adult wants to choose to have this kind of therapy, they can have it. What this seeks to do is protect children, number one. Number two, it does not prohibit alternative treatments for youth who are conflicted about their sexual orientation and identity and would like to get counseling about that. So it does not prohibit that type of counseling. And it does not prohibit pastoral counseling services provided by religious or faith officials. It only applies to licensed professionals. Having said that, and also the legislation that's been passed in other states has been signed by 4 GOP governors, 4 Republican governors. So there's been bipartisan support for this across the country. The idea of legislatively doing something about this. I'm happy to answer any questions. I know there's a lot of people here to testify about it.
Senator Carrico.
What if a pastor's a licensed clinician?
If a pastor is a licensed clinician, I guess it would depend in what capacity they're doing that. Whether or not they're doing it for
All right.
free as part of their pastoral counseling, or whether they're getting paid.
If he's licensed
Senator
and I'm,
Carrico.
and I'm a member of his congregation and I want to take my child to him,
And he's licensed, and it'd be doing it in his office where he's getting paid for it. I would
Well,
think that his
no.
licensing regulations would kick in as opposed to doing it as part of
but
his
he'd be
capacity as a
prohibited
pastor.
or he can be charged if he were to counsel.
I'm not sure. Mr. Chairman.
Make sure you come through here.
Right.
Okay, we're good. Senator Carrico, does that complete your question?
No, he had a question about whether it could be charged.
Oh, go ahead. Senator.
That was my question.
Right. It's too bad Senator Donovan's not here, but I don't think this creates a crime necessarily. It has a prohibition, and so I think there potentially could be a licensing consequence. I don't know what kind of licensing proceeding they would do in that situation, but if the person did it as part of their professional practice, and maybe somebody from the Department of Health could answer that, but if it was being done as part of a paid service they were doing, I would think the licensing would kick in. But if it was done as a pastor, that's again outside of this.
Okay.
Mr. Chairman.
All right, so next up is Senator Black. Question to the patron.
I have a question that has always troubled me with this whole area, and that is really it goes to the First Amendment, and I don't understand how we instruct people not to make a certain argument, whether they're a therapist or who they are, not to make a certain argument without violating the First Amendment. For example, you and I might argue the merits of this issue. I would never suggest that you shouldn't be able to argue your side, and I don't think you would argue that I shouldn't be able to argue mine. And now I understand with some of the things you're talking about, the castration, things of that sort, no question there. But when we're talking, whether it is a pastor or whether it's a psychologist or psychiatrist who feels that there is a means of persuasion, I don't know how we get around the First Amendment. I don't know how we prevent damaging the First Amendment whenever we tell people there are certain arguments that you may not make.
Right. Mr. Chairman, can I address that? Thank you. So what I would say to the gentleman, Mr. Chairman, is that, first of all, this doesn't apply to pastors. Again, potentially if they're licensed and it's in their office as part of getting paid to perform a service, that's one thing. But if it's pastoral counseling services that are being done through the church, that's religious counseling. So number one, I don't think that's covered by this. And I can understand the gentleman from Grayson, Senator from Grayson's potential scenario there. But with regard to doctors and the First Amendment is not absolute. If speech causes harm, it can be legally actionable, either criminally or civilly, whether it's defamatory or whether it's other types of speech which causes harm. There's all kinds of speech that we regulate, both professionally. There's certain things doctors can't say and can be sued for, and if they do, there'll be consequences. So,
Because of time, Senator Peake, why don't you go, and then we're going to hear from some.
Yeah.
Okay.
Senator, Mr. Chairman, Senator Sorville, quick question. You cited some statistics, percentages of higher suicide, higher depression.
right.
And is that based against gay juveniles who do not go through conversion therapy, or is that the juvenile population in general?
This is, first of all, that's research that I pulled 2 years ago when I presented this, and my recollection is that it's research about gay children who are not accepted by their family. There's an article I was just looking at a few minutes ago that was in the Journal of Medical Regulation, which was published in 1996, which indicated that conversion therapy is associated with higher risk of suicidal ideation, depression, and drug abuse. But I couldn't click through the footnotes to get to the end of it to figure out exactly precisely what it was saying.
Thank you.
All right, very good. Senator, thank you. And with those that are here to speak in favor of Senate Bill 245, stand forward, and we will put a clock on both sides of this. Welcome back, sir.
Thank you. Mr. Chairman, I'm Scott Price. I represent the Alliance for a Progressive Virginia. And I didn't bring my glasses, so bear with me. We have a lot of witnesses, and I'll be out of your way in a moment. I want to thank the senator for bringing this bill back. I want to point out that the state has a responsibility when it licenses a practitioner to stand by what that practitioner does and says. So it's not a First Amendment issue. If I say I'm a licensed practitioner in the state of Virginia and I can cure your child of being gay, that's not appropriate, and it's not a free speech issue because being gay is not an illness. So I want to get that across, and clearly, that's what this bill does. It's a simple thing that protects children. I'm going to get out of the way and let some more witnesses talk.
Thanks, Scott. Welcome. Yes, ma'am.
Good morning. My name is Deborah Hawkins, and I also forgot my glasses, so forgive me if I read this kind of close. But I'm a family therapist and a resident of Chesterfield County, and I urge you to pass this bill. Some of you might think that this bill would deny youth counseling about unwanted same-sex attraction. It does not. What it would prohibit is counseling using a treatment philosophy and interventions which delay effective evidence-based treatment and are psychologically damaging and harmful. As responsible adults, we often limit certain practices because youth and even their parents might want something doesn't mean it should be legal. For example, if a parent thinks their child could drive responsibly at age 14, it doesn't mean we still don't say that's not safe. Or if a parent smoked and thought their kids could smoke, we're not going to go and legalize smoking for minors. This bill is necessary to emphasize that we do not want an unethical, harmful practice of the past to continue. As professionals, we know effective evidence-based treatments that meet a certain quality standard of care, and conversion therapy does not. It's time to codify that Virginia rejects conversion therapy for minors. Thank you.
Great. Thank you. Yes, welcome. If you have written comments you want to present to us, we'll take those. Welcome. Yes, sir.
Mr. Chairman, David Brown, Director of the Department of Health Professions, and the administration supports this bill.
Great. Thank you for coming. Yes, ma'am. Welcome.
Mr. Chairman, Lindsay Walton with Macaulay and Jamerson, representing the Virginia chapter of the National Alliance on Mental Illness, and we support this bill.
Great. Thanks for coming. Yes, sir. Welcome.
Good morning, Mr. Chairman, members of the committee. I'm Roland Winston. I'm the chair of the Advocacy Committee for the Gay, Lesbian, Straight Education Network, which does education work for the community, and also the executive director of Mothers and Others, which does advocacy for the community. Comments from Sam Brenton, who is the Policy and Governmental Affairs Director for the Trevor Project, were submitted to the members overnight by email, so don't have any printed to hand out. We support the bill.
Great. Thanks for coming. Yes, sir. Welcome. We have about 2 minutes left. Welcome. Yes, sir.
Yeah, my name is Alex Wilson. I'm a licensed clinical social worker since 1991. Been a member of the National Association of Social Workers, the NASW, for 30 years. In the year 2000, the NASW released a statement that said, I quote, "No data demonstrates that reparative or conversion therapies are effective. It's as simple as that. The state has a compelling interest in ensuring that licensed healthcare providers follow professional standards of care and do not engage in dangerous practice that have no scientific basis and put clients at risk." Thank you for listening, and thanks for supporting.
Thank you very much. Good. Yes, ma'am.
Hi,
Welcome.
Good afternoon. Amy Canova, nationally certified school psychologist. SB 245 would ensure that mental health providers who have somehow missed the memo for the last 50 years understand that it is unacceptable, unethical, and irresponsible to attempt to change someone's sexual identity or gender expression under the guise of therapy. They will no longer be allowed to fool parents into thinking that conversion therapy is good for kids. All too often, parents who have their children's best interests at heart are coerced into sending kids to reparative therapists who are practicing fraud and endangering the lives of young people. As a Commonwealth, we need to recognize the need to provide appropriate therapies that provide empirically based acceptance, support, and understanding of LGBT youth. Thank you.
Great. Thank you very much. I know some people in the back are concerned, so just...
Morning, Gail Dady with the ACLU of Virginia. I'm sure you're all familiar with our work defending the First Amendment. We support this bill.
Thank you for coming back. Yes. Yes, sir.
Mark Lowen, licensed professional counselor in Virginia and owner of a big group practice in Richmond. We support this bill.
Thanks for coming. Yes, sir.
Joshua Brooks, I'm a licensed professional counselor and a member of the American Counseling Association. I support this bill.
Good. Thank you. Yes. Hi.
Hi, I'm with Equality of Virginia, and we support this bill for the reasons stated.
Great. And thank you for coming. Yes. Hey, welcome back.
Thank you, Jennifer Allen, Planned Parenthood Advocates. We support this bill on behalf of our LGBTQ patients across the Commonwealth.
Great. Thanks for your help. Thank you very much. With that,
Mr. Chair,
yes.
I want to ask a question of the patron.
Sure.
And I appreciate all the people who have spoken, and this is an important issue. But if you actually read the bill, one of the things that sort of concerns me is let's say somebody comes into I'm not a psychologist and I don't play one on TV, but let's say a teenager comes into my office and that person is what we would call in a different era promiscuous with somebody of the opposite sex. And you say as a psychologist, you should stop having sex with that person of the opposite sex. That's clearly not covered by this because you're not reducing their urging towards a member of the opposite sex. Now, what if they come in the same situation and they're having sex with somebody of the same sex? And now you say you should stop having that relationship. Are they now in violation of the statute?
No, not at all. That doesn't cover this. This only covers counseling that's intended to change your orientation, not prevent you from engaging in sex. That's totally
well. It says to eliminate or reduce sexual or romantic attractions or feelings. I mean, that's or.
Where are you? What line are you on?
Well, it says or to eliminate or reduce sexual or romantic attractions or feelings towards individuals of the same gender.
I think that relates to in general and not to a specific person.
Well, I guess my point is, and listen, I don't support conversion therapy, but this bill's pretty broad. And, if you counsel someone towards abstinence, I mean, unless it's abstinence in a heterosexual relationship, in which case you're not covered.
Yeah, all I can tell the gentleman is at least, the people I've been speaking with about this made it very clear to me that it's their perception that it would not be interpreted that way by the licensing authorities. And they're here, Mr. Roberts is here to probably address that question better than I can, but I don't think they view it that way either.
Well, let me just, if I might, Mr. Chair, and I don't want to beat a dead horse, but listen, I know that these are social issues and you're just supposed to vote and not actually read the legislation, but if you read the legislation, I mean, is abstinence covered by this or not?
Here's a professional. He probably answer the question better than I can.
Hi, I am a counselor. As a therapist or a psychologist, it is never the role to tell a client what to do or what not to do. So it is actually not the role of a therapist to advocate for abstinence or not abstinence. It's the role of the therapist to look at what the goals are for the client and what's going to help them from their perspective and help them get there. But conversion therapy already sets that goal. And it, before the client even comes in, already says,
I understand. Maybe can I talk, Mr. Brown?
Okay.
Mr. Chairman, very briefly.
Are you here to answer his question? Okay.
David Brown addressing the question from Senator Peterson. I think the boards in question have a clear understanding of what conversion therapy is, and I think I don't think your hypothetical would apply. That's based on the conversations. I know these boards have discussed conversion therapy, and
I'll make one
Senator Peterson,
and then I'll shut up.
Nope.
And I'm going to vote for Scott's bill. But if this gets through, this needs to be cleaned up because it's just too broad right now. The language is broader than just conversion therapy, in my opinion.
Okay. Senator Carrico.
Just real quick for Dr. Brown. So if I'm a licensed counselor and I'm not being paid, but yet I have these conversations with a family member that asks me to have it with the child, can I not be reported right now and lose my license?
If you're a licensed counselor, someone can make a complaint against you for whatever reason.
And you're going to investigate.
And it will be investigated.
Thank you.
Senator Donovan.
Mr. Chairman, and for Dr. Brown as well. That's my point. Having served on the Board of Medicine, we have an entire board of subject matter experts that hear these kinds of things. Conversion therapy is clearly not approved therapy in the clinical community now. So why are we codifying an arena of the board when we have entrusted subject matter experts to discern those matters individually as clinical practice changes?
Right.
I guess maybe I was an assertion. I apologize.
Good. Thank you. Senator Peake, you have a question, sir? Okay. Very good. So, Scott, if it's okay, we're going to go to the side where those that struggle with the bill, and you also will have 5 minutes. You don't have to take it all, but welcome to hear.
I'll try not to. Thank you. Mr. Chairman, members of the committee, Chris Friend of the Family Foundation. For those of you who are on the subcommittee that heard testimony on this bill 2 years ago, you may remember John. John came and told his story of having once had struggling with same-sex attraction, but had received counseling and no longer had that struggle. Unfortunately, he couldn't be here today to testify because he's over at MCV attending to his wife, who is very sick. Note that I said his wife. He is happily married, leading a very, very productive life, and wanted to be here today to stand before you to show you that such people actually exist. There are people who have had unwanted same-sex attraction that no longer do so because of counseling or therapy. Some people refuse to recognize the existence of these people. John wanted to be here to show you that they do exist, and there are thousands of them. This legislation is dangerous in several ways. First, despite the assurances that this doesn't apply to those who have unwanted same-sex attraction, I read the bill over and over again. I do not see a caveat for that. This is a broad bill that I do believe will prevent those who have unwanted same-sex attraction from getting counseling. It violates Virginia state law that says that a parent has a fundamental right to direct the care of their children. And finally, as been pointed out, we have a board of counseling that licenses, that complaints can go through. And if there are people who believe that something has been done that should be questioned, that's what the board is for. So for those reasons, we encourage you to vote against this bill. Thank you.
Thanks for being here today. Yes, sir. Welcome back.
At Yale, Virginia Assembly Independent Baptist, I had a pastor in our group who's a licensed counselor who had to stop, and that was part of his way of earning income because it was a small church. And he literally, because of pressures, because while people may not accept this, this is a very subjective area. Counseling is very subjective. And if we go back in the history of Virginia and the United States back in the early 1900s, there was a move to sterilize certain individuals because they thought that was in the best interest of society and those people. And what happened is we ended up having to give reparations to those individuals for that great error in judgment, and I hope we don't move the direction now. Thank you.
All right. Yes, you want to pause?
In the last century, it went on until 1971.
Okay. Thank you, Senator Saslaw, and we will begin again. You have about
people who we thought were mentally deficient.
Yes, that's right.
Whatever the hell that means.
Thank you, Mr.
You have
Chairman.
about 2 minutes left. Welcome.
Bill Ray with the Virginia Catholic Conference. Most of the points I was going to make have already been made, so I'll be brief. We do have concerns that this could affect clergy if they are also licensed psychologists, or licensed therapists, rather. Also the concerns about the broadness of the language. If it does prohibit anything that would reduce romantic attractions or feelings, this could prohibit simple counseling to chastity. Also, the enactment clause at the end is somewhat worrisome. It prevents the state from authorizing a grant or a contract with any entity that would even refer for this. So there's additional concerns if someone were to hand a list of therapists to someone and one of those therapists ended up performing something that would fall under this overly broad language, that could jeopardize grants and contracts. So we just have a number of concerns about the scope of this bill and would encourage you to oppose it. Thank you.
Great. Anyone else here speak in opposition to the bill? Okay. Senator Black.
Yes, thank you, Mr. Chairman. I'd just like to make a comment. I just looked up as we were talking. There's Dr. Robert Spitzer, a psychiatry professor at Columbia University, who began his study on conversion therapy as a skeptic. He did not believe that it was something that worked, and yet his analysis indicated that of 143 men, 57 women who said that they had these same-sex attractions, that there were a substantial number who had achieved a very smooth heterosexual functionality. And I just point that out because I have seen dozens and dozens and dozens of similar studies, and it sort of goes back to the First Amendment. I have, not just with this bill, but with many things, I really am very uneasy with the idea that we instruct people that they cannot express their beliefs, their opinions, even though those opinions may be difficult for other people to accept. And I, you know, we've seen psychiatry. You know, if you go back to the DSM-4 from years and years ago, it said things that were radically different than today. And so the idea that you would just simply say, well, we're going to fix it in place and we're going to make it unchangeable forever. I think that these are matters of opinion, and I think that reasonable people should be able to express their opinion. If somebody does not like that type of therapy, they are quite free in our marketplace to say, I don't like what you're doing, and I'm going to go to somebody else who will take a different approach. So.
Okay. Senator Black, thank you very much.
Mr. Chairman.
Yeah, Senator Howe.
I would just like to point out that we're talking here about children. We're just saying that children cannot be subjected to this therapy. If any adult wants it, it doesn't impact them at all.
Any other comments by committee members? Scott, why don't you just sum up real quickly, and then we'll take a vote. Thank you.
Mr. Chairman, I just would point out again that virtually, I'm not aware of any professional organization engaged in any kind of psychological, psychiatric counseling which says this is an approved practice. I've listed them out. It's been rejected, as you heard, for a long time. The APA, in 2009, the American Psychological Association issued a report speaking to the gentleman from Lynchburg, Senator from Lynchburg's question, that they found the harms associated with conversion therapy include anxiety, depression, suicidality, guilt, helplessness, hopelessness, shame, social withdrawal, substance abuse, stress, self-blame, decreased self-esteem, increased self-hatred, problems in behaviors, high-risk sexual behaviors, deterioration in relationships with family. And that's if people do this. We're talking about children. Children don't have a choice. We heard testimony 2 years ago from people who had been through this, who had tried to commit suicide. We heard testimony 2 years ago from families who said they'd been duped into doing this and they didn't like it. And I think we really ought to step in.
Okay. Scott, thank you very much. And is there any other committee member have any comments? Senator Chase.
Senator Sarvel, I guess the question I had is, where are the parents in this situation? We're talking about children that are 18 years and under. I'm just curious. Where are the parents in this situation making those decisions for the kids?
I'm not sure I completely understand your question because
the parents have a say is basically what she's saying. I mean, you're saying that you can't do it
correct.
no matter what the parents say. Is that correct?
That's correct. And there's lots of different things like that where we tell parents they can't do it. You heard of several listed, including allowing your kid to smoke or drink or engage in other kinds of behaviors which are harmful to children, which we've deemed are harmful to children. Actually, you could let your kid drink, I think, but but smoking, I think, has been prohibited. And obviously, I don't think you could sanction any kind of medical procedure for your child, which would be harmful to the child. I don't think any doctor would do it. It's probably illegal.
Okay. Any other question? Senator Sarvel, I appreciate you coming forward, and as always, a very succinct presentation. Senator, I think we could come to an agreement on some conversion therapy as it used to mean, which is a lot of terrible things. Honestly, there's the chemical castration, the some of the shock therapy, some really tough things. Maybe we can work on that. There is this entire question about whether it reaches into the parents and the pastor's role, and so I think that's kind of the struggle. It's not disrespect to your position and your presentation here that is of a little bit of concern, but I thank you for coming. So, sure. Is there a motion on the bill?
Move to report.
There's a motion to report, and there's a substitute motion to. There's a motion to PBI, and then there's a substitute motion to report. Therefore, the primary motion is that we report the bill. All those in favor of reporting the bill will record the votes aye. Those opposed, no. The clerk will close the roll.
Yeas 7, nays 8.
Okay. Yeas 7, nays 8, the bill does not report. And then the underlying motion is the bill be PBI'd. All those in favor of the bill will clear the board. Okay. All those in favor of PBI'ing the bill record their votes aye. Those opposed, no. Clerk will close the roll.
Yeas 8, nays 7.
The bill is passed by indefinitely by an 8-7 vote. Scott, thanks for
Thank you.
coming.
Appreciate the committee's time and the discussion. Thank you.
Yes, sir. Thank you.